You know, there are very few moments in life as meaningful and as beautiful as the birth of your first child. But for many mothers across the United States, that is also a gut-wrenching and terrifying moment. And that's because they know that as soon as the doctor snips the umbilical cord, they are going to have to fight to try to keep that baby. Take, for example, Jade Dass. She's a woman who was 26 years old when she realized that she was pregnant, and at the time, she and her boyfriend had both been recovering from opioid addiction. So as a treatment, she was prescribed Suboxone, also known as buprenorphine, which is a medication that prevents withdrawal, which, you know, you might automatically think is risky for a fetus. I mean, you're not even supposed to take ibuprofen while pregnant. But while it can make newborns experience withdrawal symptoms, these are only temporary and they're easily treatable. Whereas on the other hand, if you quit the meds, that could trigger withdrawal, which could in turn lead to relapse and potential overdose, or contractions that could result in a miscarriage or premature birth. But in January of 2021, Jade gave birth to what tests showed was a healthy baby girl with no documented withdrawal symptoms. But then, just an hour later, the hospital called Arizona's Department of Child Safety to report a case of suspected child abuse or neglect. And that's because the toxicology test came back positive for Suboxone, and regardless of whether the nurses actually believed that was evidence of abuse, they legally had to report it. And the reason for that, it requires a little explanation.
In the 1970s, there was a law adopted by the federal government called the Child Abuse Prevention and Treatment Act.
Right, that's Harvard resident Dr. Rohan Kazanchi, who for you might be a familiar face by now. Right, he's hopped on for our stories about race-adjusted medicine and excited delirium, and that law that he just mentioned kicked off all of what we're about to dive into. Right, and among other things, it defined child abuse and neglect and required states to gather data on those crimes.
This law has been updated almost every decade. In the early 2000s, mid-2000s, it was updated to include sort of exposure in utero to quote unquote, an addictive substance or dependence on an addictive substance at birth.
And a key thing is that substance doesn't have to be an illicit one. So a pregnant mother taking prescribed medication to treat opioid addiction, such as buprenorphine or methadone, is treated the same as someone taking actual opioids.
So essentially punishing parents for seeking evidence-based treatment for their opioid use disorders.
And the consequences of this are what you'd expect, right? So in a video call with a child welfare investigator, Jade defended herself against an onslaught of questions about her past addiction and recovery. But a week later, a nurse, a security guard, and the investigator showed up to her hospital room in person with an order to remove her newborn baby from her. She recalled this to the New York Times and revealed,
"It was just like pure despair. I don't even know how to explain it."
And so now the battle was on to win her daughter back, with a judge throwing up endless hoops for her to jump through: a substance abuse assessment, counseling, parenting classes, a psychological consultation, weekly sessions, and family treatment court. She also had to sign over all of her medical, mental health, and Suboxone treatment records, submit to 8 to 10 random drug tests per month, and resolve any open criminal cases, which for her were just things like shoplifting and trespassing for when she was homeless years ago. And if she did all that, then she and her boyfriend Ryan could see their daughter 3 times a week inside a government office. And eventually, thanks to the intervention of tribal social services, Ryan got custody of the baby, but Jade couldn't live with them or see her daughter without supervision. But the big thing there is he couldn't supervise her because he had to work, and she couldn't work because she had no car. So then, feeling like they had no other choice, they took the baby and ran, with them packing up and driving from state to state to state. But the cops eventually caught up and threw Jade in jail for 2 months. So then their daughter went back to foster care, and they got a second chance to follow the rules and potentially reunite with her. But then in March of 2023, Jade went to court to resolve a probation violation for a misdemeanor trespassing charge from her opioid days. And to her surprise there, the judge sentenced her to 6 months in jail, which meant she could neither work on her case plan nor actually attend the next court hearing at which a judge would most likely decide her child's fate. And so now Jade's daughter is 3.5 years old and her mother has lost custody indefinitely.
All my life, I really looked forward to being a mother, and I feel like I'm having that basic human experience taken from me.
And so the situation is that now thousands of women like her have been reported to Child Protective Services for prenatal substance exposure, with many also losing their babies for weeks, months, or years, which can be stressful and traumatic. And this, even though, keep in mind, they are doing what promises the best outcome for themselves and their baby, right? I mean, mothers who use addiction meds during pregnancy are more likely to go back for recommended pediatric checkups and less likely to readmit their baby to the hospital during its first year of life. In fact, availability of those drugs is linked to reductions in certain types of child maltreatment caseloads like abuse and neglect, with an expert even telling CNN in states where there are punitive policies, including mandated reporting, birthing people are less likely to access prenatal care, less likely to use medications for opioid use disorder, less likely to use psychotherapy services, and less likely to really connect with any healthcare provider in pregnancy. But also addiction meds make up a small percentage of the drugs pregnant mothers take. Right, as of 2021, about 1 in every 5 pregnant women reported some form of substance use. And those include ones that are often legal and may not even be harmful.
Prescription opioids is another example. Some patients have severe pain, or they may have comorbidities like sickle cell disease that predispose them to having pain crises while they're pregnant. In cases like this, I also don't think we need to file a Child Protective Service report.
And while drugs like these are targeted, others that can also impact fetal health, such as insulin or medications for depression, anxiety, and ADHD, they get less scrutiny, which appears to suggest that the stigma around certain drugs may be distorting child welfare policies. And with this, we know that politics plays a role in mandatory reporting laws because they aren't applied equally everywhere.
The language in the federal law is so vague that states have chosen how to interpret this, and have had to make their own policies and recommendations to health systems how to interpret it.
So some states designate prenatal drug use as civil child abuse, and others go as far as involuntarily committing the mother, terminating her parental rights, or even criminally prosecuting her. But big picture, at least 26 states mandate reporting for prenatal substance exposure with no exceptions for prescribed opioids or addiction medications.
I think that's bizarre. I don't think that makes a lot of sense.
So understand that is not to say there are not legitimate cases where CPS intervention is needed.
If somebody has an active substance use disorder, perhaps they are not engaged in treatment, perhaps they have a recent relapse, an unsafe home environment, or just some other factor that makes it seem like there's not an ability to safely take care of their child at the time of discharge.
But even there, you have Rohan saying you need a multidisciplinary team, including an expert like a social worker, not just a single physician, to make that assessment. And if one doctor is not enough, one drug test certainly isn't either.
Organizations like the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics really recommend verbal screening during prenatal care rather than toxicology testing at the time of discharge. Getting a single urine test is not diagnostic of a substance use disorder. It's a snapshot in time, whereas a substance use disorder implies substance use that is causing impact on somebody's life and is really longitudinal over time. And the last thing is that toxicology testing is heavily limited by high false positive rates and other problems with the actual test itself.
And then, coloring everything we've talked about so far, there are racial disparities at every single step of the process.
Clinicians choosing to test people for substance use during pregnancy and choosing to even test their newborns, the filing of a report by a mandated reporter, true investigations being opened, substantiation of the investigation, separation of a family, and the choice not to reunify down the road. There are racial disparities at every single one of those steps as well.
This, even though Black mothers are no more likely to test positive for substance use while pregnant than other racial groups. In fact, among patients with a history of substance abuse, white mothers are more likely to test positive than Black mothers. And so the place where Rohan works, the Boston Medical Center, it revised its policy in 2021 to only report cases where they observed true protective concerns. What they noticed is that the impact was huge.
We found in a study that we just published earlier this year that we reduced CPS reporting by 45%, meaning 45% of cases we were able to not report because there were no protective concerns whatsoever.
So you're talking about hundreds of mothers who may have otherwise been surveilled by CPS investigators and dragged through the courts to prove they're worthy of keeping their own children.
And that bears out even when you look at CPS data. So when we look at how Massachusetts handles prenatal substance exposure reporting cases, 50% of those cases are investigated but not substantiated, meaning we're wasting state resources and taxpayer dollars.
But with experiments like his and a growing body of research establishing that mandatory reporting is too strict, lawmakers have begun to take another look at these policies. Right? You have a handful of states like Connecticut, Colorado, and Washington changing their laws so that a positive drug test no longer automatically triggers a CPS report. And instead, they evaluate each patient on a case-by-case basis, then refer them to programs and resources to help reinforce the new family. Also, federal lawmakers introduced a bill last October that would require consent for prenatal drug tests and block states from mandating reporting, at least in cases where the mother is taking a drug in accordance with the recommendations of the prescribing practitioner and the healthcare provider has no other reason to suspect the child is in imminent danger. But notably, that bill has yet to be passed as I'm recording, and most Americans haven't even really heard about this issue. So for now, you can count yourself among the few, and it'll be interesting to see if and when this passes. And in the meantime, of course, I'd love to know your thoughts.